All right. We have understood the basics of RCM cycle and the life of a claim form in the RCM cycle, how it goes from patient to the collection. Now let's understand the very first step in the patient access, that is eligibility and benefits verification, also known as EV/BV, eligibility verification, benefit verification. So this gives you a clear picture of how eligibility and benefit verification is important in the first step of patient access in RCM cycle. So imagine this, a patient walks into your clinic, all smiles and everything looks perfect. They greet the front desk, maybe even crack a joke, everything looks perfect. But behind that smile, their insurance card, is it active? Probably it might not be active. So what is going to be our immediate mission? So if we choose to accept that it's to make sure their visit doesn't turn into a billing disaster, what we have to do? No surprise, no last minute denials. This wasn't covered. This is what the insurance is going to say if everything goes not in our favor. Welcome to the Eligibility and Beneficiation Masterclass. What we are going to learn here is whether the eligibility is important. If yes, then what are the things that you need to understand? And if the benefit is important, a benefit verification is important, then what are the things that you need to understand? So by the end of this session, you will know exactly how eligibility works first. Second one is how benefit verification works. What are all the major jargons that you need to understand? The different keywords in the eligibility and benefit verification, how to verify through the portals. I'm not just going to show you the complete portal navigation, but in a nutshell, I'll tell you how to cross verify in the portals. What are all the things that we need to document, and how to prevent denials with the eligibility and benefit verification step, and how to become a star EV/BV specialist. Let's get started. So what are eligibility verification and benefit verification? Let's begin with the basics, because clarity is power. So eligibility verification, or EV, is simply checking whether the patient's insurance is active and valid for the date of service. Think of it like checking whether your Netflix subscription is still active. If it's not, no movies tonight. Simple as that. Similarly, if the patient's insurance is not active, then there is no coverage, no payment from the insurance, no reimbursement. Now, benefits verification, or BV, goes one level deeper. So what we have done above, just check whether the service is covered, the date of service is falling in the effective and termination date or not. Now, benefits verification. The answer is what is covered in the insurance plan, how much is covered, and who pays for that. Benefit verification tells you how much deductible is left out, how much coinsurance applies, whether there is any copay left out, whether there are visits limit, and what the patient must pay today. And there is a fun fact: 25% of the claims denial come from issues that could have been caught during eligibility verification and benefit verification. So if you're fixing the eligibility and benefit verification in the beginning of the RCM cycle, you can arrest 25% of the claim, 25% of the denials. So that's a very big number. So that's all about the EV/BV, and these are the backbone of a clean claim and happy patients. So I hope this is clear what is EV and BV. Let's move on to the some keywords in the RCM cycle in the eligibility and benefits verification. First one is HMO. HMO is like a strict parent. The person or the patient who is having this HMO plan, they have to stay in network. They have to get referral. What is referral? So whenever the patient goes to the PCP, primary care physician or primary care provider, what he has to do, he has to get the treatment and submit the claim form to insurance. If the PCP is unable to give the proper treatment, what he will do, he will submit the request of letter for the higher treatment to the SCP. So that is the referral, and they have to follow many rules. So that is the HMO. It's like a strict parent. And when it comes to the PPO, so PPO is like you can go to in network, you can go to out of network, and whenever something goes wrong, then just have to pay little extra for the treatment. That's all about PPO. It's like a chill parent, go anywhere you like, but it might cost you more. So that's what the insurance plan is telling about. There is one more plan, that is POS, point of service. That is also like this. So there also the patient is supposed to get, he can go to network and out of network providers. Next one is the deductible. The deductible is like, the insurance. First the patient has to pay the financial warm-up exercise, then the insurance joins the game after the basics has been paid, so that the insurance will start cover for the remaining amount. And next one is the co-insurance. Co-insurance is like the splitting a bill. So patient pays a fixed percentage, and then the insurance pays the rest, like 80% and 20% is some insurance follow. Next one is the OOP max. OOP is out of pocket maximum. And once the patient hits this amount, then the insurance covers the 100% amount. So the maximum amount the patient pays before insurance covers anything. And after that, you have the PCP, primary care provider, the patient's medical best friend, you can say, also known as the gatekeeper, because all the patients has to go through first the PCP before going into the specialty care physician. And next one is the authorization, or also known as the prior authorization. So it's like taking a permission from the insurance before they give any treatment. That is prior authorization. If we have missed to get the prior authorization, then by submitting all the medical records, we can obtain one more authorization, that is retro authorization. So that will be valid for the reimbursement. So this happens ideally within a window of 24 to 72 hours. So 48 hours. So by the time the claim hits the insurance, it is always out of the timely filing limit. This happens in the emergency cases where every second counts. Next one is the COB. COB stands for coordination of benefits. So what is coordination of benefits? So this is like a deciding factor who pays first for the patient, and if the patient has more than one insurance, then COB is very must, because the provider also should know which insurance he has to bill the first and the next. This is about some key industry terms that the eligibility and benefit verification team use on daily basis. There are a lot, but in order to keep the video short and crisp, I've added only these things. Next one is the eligibility verification and benefit verification workflow. I have not included the flowchart, but I tried to keep it very simple to make you understand. So first one is we have to gather the essential information. So what are the essential information? Now let's walk through the workflow exactly like what it happens in the real world. I will not just explain the steps, but the logic behind the verification. So before you can open any portal, payer portal, so what you need to do is you need to have the patient's full name as per the insurance card. Because if the first name and middle name or the last name is mismatched, then the insurance is going to deny, stating that cannot be insured. And after that, date of birth, then the insurance ID and group number, provider NPI, facility details, date of service, service type or CPT code, what are all the services that we are going to give. So these are some basic information that you need to keep it handy. It's like, collecting the ingredients before cooking. You need the right information to start the verification process successfully. And always compare what's in the system versus the actual card. When I say what's in the system, it is about the PMS system, the client system. The number of times Smith becomes Smith, you would be surprised. So why you need to keep all this information ready? Because names get misspelled sometimes, so IDs get typed wrong during the time of registrations. So all old cards stay in the system for years, so this is always advisable to check the existing and the current card. So single step prevents hours of rework, because if at all this goes as incorrect, the claim will get submitted to the insurance will deny, and the AR callers are going to cross verify this information. So it's a time consuming activity. So that is what it means. Next, so step 2 is verify and analyze. So first you kept all the information ready. Now the eligibility is the foundation. You verify through any of the insurance portal. For example, if the patient is having BCBS, then availability. Likewise, whatever the payers are there, their payer portals will be there, and all the patient's informations will be actively available. You need to keep all this information handy, log in there with the username and credential and put in this information, identify eligibility and benefit verification tab, put in those information, then you will get the information. Now some portals like Availity, Navinet, pair websites, sometimes you can get the eligibility information through IVR, or reaching out to the eligibility department through a live call. Then if one plan is not active, then we can check the active plan, and we can review the effective and termination dates. We can confirm the plan type like we have discussed, HMO or PPO, and verify the in-network status of the provider. So these are all the things that we will verify. And after that, one more step deeper, that is the benefits verification. um, what is your goal here? So what you're going to active, I mean, we're going to check, is the insurance active and not active. So after that, you're going to review the effective and termination date of the insurance policy, because the policy will come with the termination date. So what is the plan type? So if the plan type is like HMO, PPO, it's fine. You're going to cross verify the network status. What if the patient is having a Medicaid plan? Because every month the Medicaid plan changes, so the patient should be eligible for the Medicaid every month, and it changes in different states, because it is governed by it is monitored by the state. And let me give you a real scenario on this thing. A patient comes in saying, yes, everything is fine, everything is same as per the insurance card, there are no changes. But when you check in the portal for this on information, their plan terminated last month, or the name is not matching as per the patient is giving verbally. So that is kind of a red flag. So this is why we never trust verbal confirmation. We trust the insurance portal, and we trust the documentation. Next, step 3 is analyzing the benefit. So this is where your detective works begin. You will check for the deductible. Then deductible is going to be the individual deductible, family deductible, in-network deductible, out-of-network deductible, annual deductible, or lifetime deductible. So how much the patient has utilized or exhausted, and how much is there for this date of service, current date of service. So that information is very much enough to come to a conclusion if we give the service, we are going to get the payment or not. Then does the patient owe any fixed amount in terms of copay or the co-insurance? If yes, then what percentage of co-insurance is allowed? And after that, you're going to get the limits for the visits. So if the therapy might allow only 20 visits per year, so if it is more than that, then the insurance is not going to cover for that. Then there will be age restriction for the infants, newborn, adults, elders. So we cannot perform all the surgeries on all the age groups. Also, likewise, the gender restriction will be there. So the services which can be rendered on females cannot be, sometimes cannot be given on to the male likewise. So, and service specific rules. Now let's say you're verifying benefit verification for a physical therapy. So the patient might have 20 visits per year. Then after that, you're going to check for the co-insurance, what kind of percentage the patient is owing after submitting the claim form to insurance. Is it 80% or 50%, what it is? And after the deductible is met, we are going to make the I mean, we're going to get the payment. So without knowing this, you cannot advise front desk or billing. So you can just understand in this way. Benefit verification is like reading a menu. You are checking what's available, how much it costs, and whether you have any coupon or not. So that summarizes the step 2 and 3 of verifying and analyzing the eligibility and the benefit. Moving on to the next, for we have the authorizations and the secondary insurance and the referrals. So here, some services require prior authorization. So what is prior authorization? Not all services are created equal. So we have to determine if prior auth is needed or not, or if referral is required or not, or some special documents are necessary for imaging, surgery, and specialty visits often need authorization. So we have to cross verify. Then only our claim is going to be the clean claim, and we're going to receive the payment. So there is one golden rule. Um, no auth last time does not mean no auth today. So every time we have to check the authorization. So if the sometimes it works out, if the same service was rendered to the patient and authorization is there in our system, if we have submitted the claim form to insurance and they're getting denied, then we can take that as the, what do you say, previous authorization, and submit it to consider for this service, so that insurance will make a payment. So that is one. So policies change, rules change, payers change their mind quite often. So this is very much important. Now, after that, checking the secondary insurance. So if the patient has dual insurance, we must verify which insurance is primary, which insurance is secondary. Also about the COB status and the patient's eligibility response or sequences. For example, if the patient is having Medicare is primary and Medicaid is secondary, so this is always advisable to submit the claim form to the primary insurance, that's Medicare, and we cannot directly bill it to the secondary insurance, that is Medicaid. So that is the reason we have to submit the claim form to primary insurance, along with the claim form and the EOB we have to submit it to the secondary insurance. Then only they will be considering for the reimbursement. So that is one of the golden rules. So if we are not following, if we are submitting the claim form to secondary insurance without any cross verifying information, obviously it is going to be a disaster one. So that is one of the important thing, verifying the authorization and verifying the secondary insurance detail, that is EOB information. And after that, there is a fun fact: never assume, no auth last visit, no auth today. So this is what I told you. So if we have obtained authorization last time, then it doesn't mean that authorization is not needed today. So it is always advisable to cross verify if the authorization is required for the service that we are going to render or not. And the sixth and seventh step, that is the documenting everything and communication about the results. So let's look into it. So this step decides whether your work is respected or lost forever. So this is very much important. So after doing all the research and cross verifying of the insurance eligibility, whether the eligibility, I mean patient policy is active or not, by looking into the payer portal, checking the effective termination date, plan type, in network, out of network, analyzing the deductible, copay, coinsurance, and the types of visits, and checking the authorization and referrals. So checking the secondary insurance, if you are not documenting, then that doesn't make any sense. So this is kind of heart of RCM. So this step decides whether your work is respected or not. So that is what I mean here. So what are all the things that we're going to document here? So it's like a king or queen. So you're going to include the active or inactive status of the policy, and the benefit summary, authorization details, call reference numbers if it was through the live call. If you have logged into the portal and checked the eligibility and benefit verification, you're going to take the screenshot of it, and the date and time, initials of the representative that you spoke with. So that is very much evident that you already did your work and you're documenting it. So if it is not documented, it didn't happen. So it applies everywhere. If it is documented, you are a hero to the billing team. That's what I mean. And after that, communicating the results. Now you have done everything in your capability. You have to find, I mean, you have to send your findings clearly to the front desk. So it is always advisable to do it in 48 to 72 hours. So if they are giving you, well and good, then you have to schedule, it is going to be very important for the scheduling team to schedule the what is it, data service for the patient, so for the billing department as well, and for the clinical team as well. So you're going to do this. So for example, Act, patient policy is active, copay is $25, and no authorization is needed. So otherwise, patient is inactive, patient notified, prior authorization is required, sent to authorizations team. Whatever it is, we're going to document it. So after that, let's talk about the best practices. So these are the 7 steps that comes in the eligibility and benefit verification. Best practices for excellence in eligibility and benefit. So now let's talk about the best practices. So what specialists follow? So first one is step one, or you can say best practice one. Um, Verify 40 to 72 hours before date of service. So this is always advisable to keep everything ready before patient hops into the hospital. So it avoids last minute chaos. So think of it like checking your flight status the day before, not at the direct airport. So it is going to be chaos. So that is why it is always advisable to check the information before 48 to 72 hours before the date of service or the treatment date. And the second one is always review the insurance card. So insurance will have front and back side. So the back has the payer information, the fine print of healthcare, so do not skip it. So you will be getting some information over there also. So always advisable to check the front and back of the insurance card. And never trust the old data. You can check it, I mean you can use it for cross verification, but you never trust the old data. So patient says my insurance did not change from past 3 months ago, like that. So when we look into it, the reality is different. So it changed 3 months ago. So that means the payment is also going to be affected. So that is why never trust old data. You can keep it as a reference point. So you can, when you log into the portal or reach out to the insurance through call, you can keep that information handy to cross verify if it is right or wrong. Next, we have to check the service specific benefits. So double checking is always important. So different services have different rules. An MRI isn't an X-ray. So therapy isn't an office visit. So each and every services needs to be thoroughly cross verified before the service. Next, double check the deductible and OOP maximum or out of pocket maximum. So patients appreciate honest estimates. So billing appreciates fewer surprises. So this is very much simple, plain and simple. And use payer portals first, so they are faster than calling. So throughout US there will be so many insurances and so many hospitals and so many agents reaching out to the insurances, so it becomes difficult for us to directly talk to the representative, so due to long hold and all other stuff. So it is always advisable, log into the portal immediately the moment you give the information. You will get the right eligibility and benefit verification. And reps sometimes just read the portal info anyways. So as per the experience I can say this, so whatever you are going to do in the portal, they are going to do the same thing. So you're going to log into the portal, check the information in the portal first, then before calling it to the insurance. So sometimes you will also get in the IVR status as well. The moment you dial the number, whenever you dial, you're going to get other information. After that, so this is about the best practices. You have done everything. Now know the payer quirks. Okay, every payer has its own personality. Understanding these quirks makes your job smoother and more efficient. So for example, UHC. Okay, so UHC loves prior authorization, so expect them for nearly everything beyond basic office visits. So Medicaid plans change often, every month they change, and it's like a subscription plan. Stay vigilant with eligibility checks. And BCBS, so they differ from state to state because this is one of the biggest commercial insurance which is there in the US. And ask the right questions during the calls. If the call is placed to the insurance, you're going to check, is this benefit subject to deductible, is prior authorization required for the CPT code, for example 97110, and what is the patient's financial responsibility. All these informations you need to ask during the call, because once you reach out to the insurance representative, it makes really sense to gather all the information in one call rather than replacing the second call and being on hold for a very long time. So this is all about the payers. And live calls becomes a little hectic than the payer portals, because considering the long hold, it doesn't mean that all the pairs have long hold. It depends. So if the 100 callers are reaching out, then you might experience heavy call volume. If not, you can reach out directly. But in order to ease our work, they have introduced the pair portal, so that information is also available. So it is best thing to first cross verify in the portal for all the information which is there. If it is not sufficing the request, then you can go with the call. So next one is communicating clearly with the team. Okay. So eligibility isn't about checking insurance. It's about keeping the healthcare experience smooth, stress-free, and denial-proof with the right skills, knowledge, and attention to detail. You prevent chaos before it starts. So, like I said, 25% are we in the beginning of the video we saw 25% of the denial, and now we understand how can we arrest this 25% of the denials. By catching issues early during the verification, you can do it. And with this, when we do this thing, 100% patient satisfaction will be there. And when they know what to expect financially. That's the best thing that we can do, and it is also a stress free for the providers. So if we look into everything, billing surprises when you document and communicate clearly, 0% of the denials. So remember, document like a pro, communicate clearly with the teams, and never stop learning, because you're the superhero preventing the claim from the denial case. Of course, other teams are also there. Now, that's all about the eligibility and verification. So I'm now going to summarize everything quick. Let's consolidate everything with two real world scenarios. The first one is the inactive insurance situation. A patient walks in confidently, and you verify the eligibility, and portal, when you checked into the portal by giving the username, everything, then the portal shows terminated. So what are you going to do? It you document it. You inform front desk that patient is notified for the self pay. So self pay collected. This is going to be the best thing, and result is zero denial, zero surprise, full transparency, because we will be looking into the portal and adding the screenshot if possible, or we're going to get the acknowledgement, no, to move on to the front desk. Second one, if the authorization is required, patient comes from an for an MRI. Last month, no auth was needed. This month, policy has changed. So you verify and you found out that authorization is required, and you keep provider notified. Then auth team submits the authorization, and will receive the approval. Then what happens? You will get the smooth claim, no denial, and the provider is going to be very happy. All right, coming to the conclusion. Eligibility is not just about checking insurance, it's about building a smoother, stress free healthcare experience for patients, clinics, billing teams, and insurance companies who are involved in RSM cycle for collecting the revenue. When you do eligibility verification and benefit verifications correctly, what happens? First one is claim gets paid faster, second one is denials drop, third one is patient trust the clinic, and the team relies on your accuracy because you're doing everything as per the protocol, and you become the behind the scenes hero. So keep learning, stay curious, verify like a detective, document like a pro, and communicate like a leader. Thank you for joining the eligibility and verification masterclass. So you are not just checking the insurance, you're protecting the entire revenue cycle from this 25% of the denial. Thank you, have a good rest of your day.